streaming.
But I wanted to write the title.
Oh, I don't think you can change the title yet. Because I think once it's just live stream, it's just live stream.
Right? You should have some title so people can see what we are talking about that section. I think they should see now.
We go back to the YouTube page. I think that probably will help. Yes. Okay, they can see that.
You can see it, right?
Yeah.
Okay.
We're live.
Hi guys, good morning. So we're gonna start to head and neck as we promised yesterday. So I hope that you guys reviewed my lecture. Can you tap?
No. Try again. Wait, let me try. Because I think
Yeah. Can you try? Can we decrease our side? Oh, but you have to show your. Today I'm gonna do this one in my office because we don't have a good ultrasound. Somebody else is coming. Good morning.
Hi. Did you see my post?
I did. I forgot to bring my laptop computer. We are talking.
Oh.
Yeah. So, can you see our model? Maybe you and I change the side.
Yeah, I think
Yeah.
we switched. Oh.
The room. We are living in New York City. Our room is extremely spacious.
She still says no.
She can, because it's delayed usually.
Oh, okay.
Right? It's streaming.
Let me see. Yeah, so
Yeah,
you
it's
can not
streaming.
see 2 viewers.
2 viewers already? Okay,
concurrent
who are
viewers.
you? 2 viewers. We have to find out the chat box. But why our face is so big?
It's your camera. That's
Oh. Okay. So, okay, I'm gonna put my left side of a probe to the left side of the screen, and then left side of the screen is gonna go to the medial side of the neck, which is going to the more medial side. So I'm going.
this way.
Our precious resident is Heidi. Heidi is gonna be today's model. So I'm gonna go her face. Oh, we need to some towel, but I don't
Do you
know.
want to get one?
It'll be
Yeah.
fine.
Yeah, I'll get one.
You don't mind? Yeah. So look at this. I'm her. Oh, maybe you turn a little. Oh, this is
Turn
good.
more this way.
Swivel
Can you
chair.
watch that?
Oh.
Okay, here we go.
Okay. So I'm at her ears. In front of the ear. Do you see that? That's the salivary glands. I'm gonna change the height or depth of the screen. So a little shallow. So if you look at her, see, look now, you see big parotid gland, which is the anterior lobe. If I move my probe to the nose, which is anteriorly, you can see masseter muscles. Heidi, can you bite? Okay, so masseter muscles, which is for chewing and closing mouth. And then if I move front, it's getting bigger, right? So this is the place. And then do you see there's some space? Actually, that's the underneath. That one is the lateral pterygoid. Remember, between 2 bones. Can you open your mouth? See? There is wow. So, yesterday I had the feedback from my resident who was asking me if I can show the probe transducer site where I'm putting the transducer to see all the muscles. You can see I'm doing longitudinally. I put the transducer, but if I do transverse, left side of the screen is going to be front. I'm putting this way. So now look at this right side. You can see, can you see the screen? Dark one, this is the parotid duct. The round dark one, parotid duct. And then right side, the hazy one. I have to use my cursor. My assistant, Amy, went to get the towel now. So look at the right side of the screen. Come on in, cursor. Not the cursor. I have to use this cursor. Good. Oh, we have another assistant came. So you guys gonna
That's why you're here.
because I forgot to bring my laptop computer. So-
That's why you're here.
Mhm.
Okay.
That's why we're here.
I brought a gown, Heidi, if you want to throw it over you.
Yeah.
that's okay.
Oh, that's good. So we have a lot of system going on now. Hold it this one.
Oh, then,
Oh, this is great actually.
yeah.
More
I thought that'd be
assistant.
easier.
Yeah.
Okay.
In New York City, we
All
go
right.
with the fashion. This is new fashion of our resident.
Dr. Kim, how do you have so much energy?
I feel like I'm getting
I
a
know
haircut.
Dr. Kim never says I want to be famous YouTuber.
Yeah.
Okay, so left side of the screen is going to be the front or nose, and then the right side of the screen is going to be ear side. So as we learned, in front of ear, you can see parotid gland. So look at this. Do you see? Oh, this is really good camera. I think my room is the best room. Okay, so if you look at the screen of the right side, there's a. I think someone is gonna move the cursor, right?
Yeah, I could. Here, let me throw this.
This is gonna be
Just
the
in case.
leftover parotid glands. I hope I brushed my teeth enough. Not really. I'm so close to my Heidi's face. Okay, so can you show some parotid gland with your cursor? Yeah, that's the parotid gland, which means that's close to the ear. And if I move my probe to the nose, which is the front part, you can see the masseter muscle. And if I move my probe to more proximally, you can see, look at that. I'm going to show you lateral pterygoid, right? So here you have yesterday in my lecture, here is the zygomatic arch. This is the condylar process. This is the conoid process. In here, in between process, you can feel the dimple. Here, I'm going to probe over the dimple area.
1 second.
Oh, my another mother is moving now. So here,
All right, this way. It's better. I can see stuff.
here, two bone shed. It's gonna be hard for me. Masseter, and if I move, still masseter. I think this was better yet.
It should be
This
like
way.
underneath, right?
Underneath of the zygomatic arch, but here, this is the perfect place. Oh, there's bone shadow,
Yeah.
which is my right side, which means coronoid process. And if I move to the, that's the condylar.
Yeah, it's condylar.
Listen, condylar process. And if I move my probe to the front, I should have another bone shadow over there. Right, that one, yeah. That is the coronoid process. And above, that is the masseter muscle. And then there's leftover parotid gland. You can see a little bit homogeneous, hypoechoic one. And then can you show the lateral? Yeah. Where the cursor, that's the lateral. I can see it actually.
Yeah.
Can you change the, no, not that one.
It's
Can
like
you
in the
gain?
groove only.
Yeah. Now can you guys
Right
see
there.
cursor? That's the lateral pterygoid. So now Heidi is going to open her mouth and close. Open her mouth. So you can see it, move the cursor where the, yeah. Now it's very clearly you can see the lateral pterygoid. Okay, once again. And Amy is going to try to show how, Amy is our pediatric fellow, future star. And then
star.
I'm going to go
Rising star.
rising star. Okay. I'm gonna make it deeper so you guys can see it.
What am I want me to show the lateral?
Show the lateral pterygoid, coronoid, the condylar. So this is the condylar.
Is on the left.
Hold on a second. I'm gonna use my cursor. This is the condylar process, which is the close to the ear lobe.
Yeah.
And then she's gonna move. This is the masseter muscle. This is the fascia line between the masseter and lateral pterygoid. Underneath the lateral pterygoid, if she moves to the front, you can see coronoid process here. See bone shadow.
Mm-hmm.
It's very nice.
Yeah, very clear.
So now, see, when I make deeper, you can see even better, right?
Yeah.
Between the coronoid process
Yeah.
and
it's
condylar
just the-
process,
Which part? Yeah.
masseter
The-
muscle, and this is a fascia, and this whole square things are
Lateral
pterygoid.
lateral pterygoid. Yeah, bingo. And now I'm gonna do injection to lateral pterygoid outer plate. So
That meat.
my needle comes from like, oh, this is beautiful actually. P1, and then we didn't put the test vera today. Okay, so now everybody understood how you can get to lateral pterygoid when you have a patient who has a
we
brain
can't.
injuries.
Sorry to interrupt. We can't store it
Oh, that's I know.
because there's
So
yeah.
if your patient had a head injuries, and then you can take it off. If your patient has a head injuries, some patient cannot open mouth, which is trismus. So you cannot intubate. Those patients you're gonna do masseter and temporalis because the patient already closed mouth. Therefore, you will not be able to do medial pterygoid, which is you can approach from the mouth. I don't know, you can see here, open mouth. But some doctors approach from here, but I never done it and I get scared. So, but my experience is that if you do injection to masseter and temporalis, if the patient is teenager adult, I will give temporalis about 30 units of botulinum toxin A, and then masseter is about 20 to 30, and then within 2 to 3 days, actually you guys can open the mouth. So for example, when I helped the patient in ICU, they had to intubate through the nose because they couldn't open the mouth after the head injury.
Wow.
Then, after I did the botulinum toxin injection, they were able to change the ET tube through the mouth from the nose. So you guys can actually help these patients. But we are pediatric physiatrists, Amy and I. But what happens, a lot of the patients with head injury or cerebral palsy, they have a pseudo-bulbar palsy. So bulbar muscle involved. So their muscle is always open. Like they have no control over mouth muscles. So a lot of patients open their mouth. They giggle and drools. And then what happened is they cannot approximate their mouth. They cannot talk. So I start to think about it, how I can help them out. And the lateral pterygoid is the major muscle, which is the mouth opening muscle. So when I did the injection to lateral pterygoid, actually patients start to close their mouth. They were able to even make words. And then they were able to swallow saliva and digest. And they start to gain weight. So which is really good. And then if Heidi doesn't mind, I think Amy is going to show us temporalis muscles, which is really not necessary to use ultrasound, but I think it's looking at the one muscle one time is really important. Now we're going to go to temporal
Are you
muscle.
okay?
Yes.
Yeah.
Go for it.
We're going to
So
pay
turn
her,
it-
okay? Pay Heidi
Turn
with the
so it's a
Starbucks
screen.
coffee today.
Yes,
Uh,
Well, just,
Right? Starbucks coffee, yeah!
Well, just
It's
watch that.
April!
It is April.
So can you see her? Look, it's very big. Looks like infraspinatus to me. White line. Let me see cursor. This is the bone, right? Along the bone. This is the muscle. Okay, Heidi, bite. See?
Yeah.
Masseter, I'm sorry. Temporalis is you can actually when I do the injection, you can use of course ultrasound put the needle, but I usually hold the skin. Let's say this clean one. I hold here and then put the needle like this. So sometimes it's very hard to hold the probe and then do the injection, but you can just ask patient to bite if you have normal grown up, someone who has TMJ problems. But children,
That's me.
you can just hold it. You can just hold it and do the injection. Don't hit the bone, or just before the bone, you can drop the medication. But as you see, temporalis is bigger. Maybe Heidi has some problem with the TMJ.
I do, actually.
Because her
Wait, is that why you need so much?
her temporalis is quite hypertrophic to me. Show them one more time. This is very special, special temporalis, okay? So look at this. I never seen actually this much huge hypertrophic temporalis. Now I'm gonna start to treat my Heidi for free. So when you do the actual injection, you can take it off. 4 places. One here, temporal, and then you go to the hair here, another one. Around the ear, another one. You can split 4 different places to the injection. Mascara, you can do 1, 2, or 1. So about 30 units, 20 units, or 30, 30. Depends on the size. So when you do children, you're never going to use a 30, 30 is too much. Okay, then now I hope that everybody understood temporal and the masseter. And so we're going to go salivary glands, right? Let's do salivary glands.
Let's see how big those are.
Use the other side of my face.
Oh, good.
Does that work?
Yeah.
So for the salivary glands, when you actually sometimes I do injection with the seating posture too. Actually, if the patient has very severe aspiration pneumonia history, like ALS patient, I don't have them lay down because they are grown up. They understand what we are doing. So with the sitting posture, actually, I do injection, but for children, I have them lay down. When they lay down, you have to hyperextend a little bit. You can use the pillow underneath of the neck and a little hyperextension and turn their face and put the probe along the mandible. So once again, my left side of the screen is going to be the front part or medial side, and lateral side is going to be the right side. So look at the mandible here. Angle of the mandible is your home base, and then my probe is going to be at the end of the angle of mandible. As soon as last time they taught me how to say this is upward, push upward. So how do we say?
Push up.
Push
upward,
up.
Push upward.
Push upward, okay? This is the English class too.
Yeah.
Push upward, okay? So look at this. Already I'm getting this is great because I can show something else.
So,
She has lymph node. She's a problem maker. She bites a lot, and she has lymph node from the caries, dental caries. So look at this. Now, Princess, the right side of the screen, you can see the cursor. That's the submandibular glands. And then can you show the mylohyoid muscle?
Yeah, that's it. Yeah.
Yeah, mylohyoid, and underneath is going to be hypoglossus, because then under the hypoglossus, the tongue. Gloss means tongue, right? So tongue, Heidi is going to move her tongue. She has something to say to me, but shut up. Oh, I'm sorry. So that's the tongue. And then look at this. I'm going to move my probe to a little bit over lateral side. So what I'm trying to show, you remember I said there is a tonsil. You can make it deeper. Can you give me a little more depth?
wait, there are 2 muscles, right?
Yeah.
2 muscles coming in.
Mylohyoid, and the second one is what?
Yeah.
The
So
Mylohyoid and
mylohyoid. So look at this, guys. This is the best moving like this, or the dark one. Yeah. Yeah. But we show the tonsil on the lecture. There's a white tinged one, the very hyperechoic stuff, is the saliva and air mixed together, and then the darker area is tonsil underneath. Can you draw this? All the dark area is the tonsil. And then if I move, and also my resident gave me the feedback, like yesterday, you don't know where you can put the probe down. Let's start again. Underneath of the chin, I'm moving my probe a little down to make sure I see tonsil, and then submandibular gland, which it could be, this is whole size actually, submandibular glands. And then there's dark on the right side. Round dark. No, not that one. That's bone shadow. That one. That one is her lymph node. Lymph node is much darker, very not the homogeneous or like a hazy one, more clearly dark. See, that's the lymph node. So don't get upset or that's not tumor. That's lymph node. And then underneath, if you put the color flow underneath of that lymph node, you can see. Remember facial artery running through. See, you can see all the vessels are firing. So in the middle of not the parotid glands, submandibular glands, facial artery and vein are running through the submandibular glands. So be careful when you do the injections. Sometimes you cannot see well, right? And then, so now let's just summarize. Amy is gonna do review, and then I'm gonna explain one more time.
Mhm.
I think this is better, right? Very clear.
Yeah, it's very clear.
It's very clear, yeah.
Should save some
Yeah.
pictures though.
Okay, so for the friends, can you put a little more gel? Sure. It's interesting. The YouTube is a lot better than actual screen of the ultrasound.
Yeah, this is really good.
Even the laptop is better, but this is just awesome.
Yeah. So we have to do here. We're gonna limit the membership. Okay.
Wow.
Now, Dr. Tinelia is putting her probe. So as you see, I cannot see the submandibular glands well shaped yet, right? So let's say what's the difference between Amy and me? Amy's probe is not in the right place, right? So now,
There's better.
so what happened now? She flipped over the probe. The probe direction is different. Now you guys can see left
it's on the
side.
left. Do you want me to switch it back?
Yeah, for the people. So okay, massage, massage your neck. Okay, turn. Okay, so
Can you lean?
lean a
Yeah,
little bit.
There
Yeah.
we go.
Yeah, it's better.
Okay, now you see same one, right? This is beautiful. I think my Heidi talks very well because it's beautiful submandibular glands looks like a reversed triangle. Can you show all the submandibular glands? Yeah, kind of almond shape or reversed triangle. And then this is the submandibular gland, and the muscle is coming in. Can you show the muscle a little better? Two muscles. Now a little. Yeah, that's the one. This is the mylohyoid. This is the hypoglossus, and then tongue pops out, right? And then if you see here in the dark area, if you go to the more lateral side, when you see the tongue, that's medial side of the face, okay? You see very hyperechoic tinged one dark gland, which is a tonsil. And then now Amy is gonna move her transducer to the laterally. Okay, laterally you start to see something different, homogeneous, similar with the submandibular glands, but it's much wider. Can you move to the lateral side a little more? Yeah, and then you tilt your probe a little bit. There's a lot of. See, I see it a little
That's
bit.
carotid. So
Yeah.
That's right.
Yes, there we go. So
carotid.
stay there. This is gonna be submandibular glands, and almost the submandibular gland and parotid gland are kissing each other. This is the parotid glands. Parotid gland color is a little more hyperechoic, even though they are both hypoechoic. So this dark one is the submandibular glands. Now you guys start to see the posterior lobe of parotid glands. Now Amy is going to move her probe continuously to the face in front of the ear. Okay, you go up, turn, curve. Yeah, good. Vertically. You see actually masseter now, which means her probe is not just in front of the earlobe. Yes. So you go backward, close to the ear. See, now you see the.
I think you need more gel.
Oh yeah.
It's very dry.
She's very stingy with the gel.
no, there's plenty of.
It's just on my neck.
No, it's just, there's gel. It's just not in the right place. Try that. Better.
Okay, so that's the masseter, right? You can see stripes, and that's the very healthy. And I start to see masseter underneath the lateral pterygoid, right? Now you guys can see it? Okay. This is the masseter. She is putting the transducer longitudinally. So you can see actually only upper part of the bone, right? And the mandible here. So this is the masseter. This is the lateral pterygoid. But since we taught, but you can do two different ways, right? So as Amy did, put the probe in the vertically, the top one, which is the right side, is the right side?
Top is right, correct.
Top is the right, which means the zygomatic arch, right? And the left side is bottom, which is the mandible, right? So forget about the coronoid process
Right.
and the condylar
It's
process.
different. Yeah.
This time, your bone is different. One is the zygomatic arch, which is on the right side of the screen. I'm going to show right side of the screen, bone shadow, this one. This is the zygomatic arch. Amy is going to move her probe to a little bit more down there to show this is the mandible, and then which is covered with masseter muscles. And then can you show the lateral pterygoid here? This is the lateral pterygoid. Heidi, can you open, close your mouth? See, you can see it's moving, right? So when she closes, masseter gets contracted. When she opens it, it disappears because masseter is not working. More lateral pterygoid here is working. Okay, then can you change it, the probe transverse way? So the way I taught on the lecture, now we can say coronoid. Oh, that's another good one, right? So here, can you show the bone shadow a little more better? You need more gel?
No, it's okay. It's easy enough to clean.
All right. So that's another good one. You can see here, actually, bone is here. See, coming out here, bone shadow, right? And then that's looks like a condylar process. And then here, if she moves out here another one, bone shadow here coming. Wide is the bone shadow in between two coronoid process and condylar process here. You cannot see because her face is she's flipped over.
Yeah, it's this
Oh,
one.
she flipped over.
Sorry.
So that's okay as long as between two bones.
Yes.
And you see masseter. She's biting, so masseter gets moved. And then this is the fascia line. You can see a little vessels over there. Underneath, I think Heidi is the best model. Look at this. This is the lateral pterygoid. So now my needle is going to go from here directly here. And then, as I said, if you're a beginner to the injection, I usually give about 20 to 30 units of onabotulinum toxin here. When you do that, if you are not so sure, I usually connect with the nerve stimulator. And then actually, if you are close to the motor point of the lateral pterygoid, patient mouth is going to be automatically open, close, open, close. When I prepare next lecture, actually, I have a video of those things so I can show you guys. Very good. Now,
you go out of plane, right?
Yeah, out of plane. But if the baby is small, and the needle is long, we can do in plane. We can almost like out of plane, but
From
you can
the
go
ear?
like this.
Got
Yeah,
it.
like
This
this.
way.
Slanting. You can slant your needle. Okay, now I think we finished the face. So you guys understood the temporalis, right? Temporalis masseter lateral pterygoid.
Yeah.
That's the main muscle for us to think about chemonuerolysis. Now, we also did the submandibular glands and parotid gland. The submandibular glands.
We didn't discuss the approach for parotid gland.
Yeah, so I'm gonna say that.
Out of plane, right?
Parotid glands is you approached. We already showed the picture, but Amy is gonna put the probe over there. There's parotid glands. So you have to do like this. Go see. You have to go
really?
further,
All the way back.
all the way back,
Really on
and
top
then
of my
yeah,
head,
it's here, almost like. And if you go, I cannot. I'm sorry, I am. Here, see the dark one. I am very high. Can you? Yeah, this one in and out. This dark round one is the parotid duct.
Sorry, this is not moving well.
You have to hit the cursor one time.
Oh no, I can see it moving.
So my right side is the proximal part, which is wrong. Usually we put the left side of the screen in the proximal. So left side is the proximal of the face. That's the parotid duct. You can see a little tinge of the parotid gland and masseter muscles together. So if I move my probe more close to the ear, and then the masseter is almost gone. But interesting enough, the Heidi has a lot of, I think, hypertrophy of the masseter too.
Is that all this?
If I put, no, that's
Oh.
bone.
Oh, okay.
So Amy is asking what is underneath of the white line. White line is the bone. Underneath is the actually bone shadow. It's overlapped. There is nothing, right? Underneath of the mandible, what do you think? Nothing. So it's kind of like bone shadow. But look at my face. I'm old ladies' parotid glands has something.
Oh, yours.
You can sit around. See, you don't see masseter that much here. But Heidi, look at the Heidi's. I'm very close to her earlobe, but a lot of masseter muscle is still there.
Is
So
it
I think,
clear?
yeah, that's the one. See, look at this screen. This screen looks a lot better.
Actually clear.
Yeah.
Clear.
See, I think Heidi has a hypertrophy of the masseter. Like mine. See, you don't see any
you don't
masseter
see
here at all. Now I have
Maybe
to
a
come a
little
little bit front.
Yeah.
I move my probe to front,
It's the TMJ.
and then you can see masseter underneath of lateral pterygoid on the left side of the screen. Underneath that one, probe move. Yeah, that one. Yeah,
Oh.
that's the lateral pterygoid. Above is masseter. Yeah, now we are too good with it's all the lateral pterygoid. Okay, so we spent already 30 minutes for the face, but we're gonna show how to put the probe. So
Do
I
you want
know.
to switch?
Huh? No. I'm just
Yeah, maybe we
Yeah,
switch
I
a little
can-
bit. Yeah.
Oh, they
So
only
look at
say I
this.
need to be like 15
How are we gonna
minutes.
put the probe? Actually, you put the probe like this, right? And then if you wanna approach, I like to approach actually from the midline of the face. I have not much mistake from that, but I don't like to approach from the lateral side. I think everybody is different, but my hand doesn't work that much, so I like to approach from the midline. So you can put the needle in the middle of the probe in plane like this. Now, once you identify the glands, you put in plane like this. Or many times I approach out of plane. You put your glands to the middle of the screen, just like now, and then there's error in the transducer, right? So I put here like this. I'm gonna do my finger. See, you see my finger?
Yeah.
And then I go, and then always make sure you guys have to identify tip of the needle before you infuse the medication. Otherwise, you don't know where the medication is going. It doesn't matter in plane, out of plane. Make sure tip of the needle is in the middle of the gland. Okay, and then parotid glands, same things. How are we gonna put the? I'm sorry. So parotid gland is same things. So now you move from here. Parotid glands is much bigger than the submandibular glands. So you can do underneath from here, posterior lobe, one drop here. Or can you show the parotid glands here? Yeah, you can give half of the dose in the posterior lobe, and then you go up here. This is all posterior lobe like this. See, her glands is here more in the below the earlobe. You can do here one half, and then you can do here in front. So you have to look for the whole glands, right? Here now, if you want to do it here, I do in plane from here, like this. Or out of plane. In plane, out of plane, anything is fine, unless. Oh, now you move your. 아이고 my poor Heidi. Okay. Now I think we're gonna have. I think we're gonna change the model. She is no longer beautiful, so we are changing the model.
You still don't know.
No, that's totally fine.
Okay.
It's okay.
Okay, now you stand up.
All right.
Thank you. And then.
I don't even know where to go.
If you want, you can come here. Okay. Alright. So I'll need to leave at like 15 minutes.
I'll model this way.
You'll model?
Yeah.
Okay.
Yeah, Amy and I can handle. Appreciate business, but you are on call, so we're not gonna torture you.
Two patients. One of them without chronic fatigue.
You're kidding.
Okay, so now we switch the model. We're gonna talk about brachial plexus.
Yeah.
Do you mind take my mask off?
Yeah, because
You
we
need to
are all
see.
vaccinated, so according to CDC guideline, we can take off the
This is cozy.
Right?
Yeah,
It is.
mask.
It's a nice little blanket.
Don't
Yeah,
snore,
this
okay?
way.
So let's say that could be better like this,
Yeah.
right? So when you I think I showed the cross-sectional view of the C6 level,
Mhm.
right? Because your home base can be thyroid. Thyroid glands is between C5 to T1. So let's say when you start to see thyroid, you may think, oh, I'm close to C5, 6. But what did we learn yesterday? We go with the anterior tubercle, posterior tubercle too. So let's see what happened. I think Amy was a very good model last time. So we're going to put the anterior part on the left side of the screen, okay? Okay, so let's say I'm putting in the middle of the her neck. Let's say Amy's neck, C1, 2, 3, 1, 2, 3, 4, 5. I thought around here could be 5. So if I put it here, thyroid gland is over there. Can you show the thyroid glands? Trachea on the left side. That's the thyroid gland, right? Looks like the submandibular glands. If I move up, disappeared. No more thyroid gland. So I must be C5, 6 level. Now we all understand, right? Almost in the middle of the neck. Jordan, are you listening to me? Jordan was asking the questions. And then I'm bringing it down, and the thyroid gets bigger, right? So see? So I must be like close to T1 now. It's disappearing. Oh, here you can see, look at that. The cursor area, the cursor, that one is thyroid gland. Underneath of that cursor is what muscle is that? Prevertebral muscle. Neck flexor muscle. Longus colli. So longus colli was long muscle. So I'm gonna find the longus colli continuously. You're gonna see longus colli. See? Can you move your cursor? Right? And the longus colli goes back and forth. But what remember? Prevertebral muscle was 2 muscles. One is the longus colli, longus capitis, right? But longus capitis, we learned that it's the longus capitis. So it's the origin is the occipital bone. So it's proximal, above the half of the neck from the C6. So this was a kind of C6 or C5. Now you may start to see longus colli and longus capitis here. So colli you see on the underneath of the thyroid, right? And then if I go that one, the dark one, that's the longus capitis. So when you see the longus colli and capitis, you are in the above or at the C5, 6 already. So now we know C5, 6 very well. So look at this Amy's neck, almost like half of her neck. Do you see it? Amy has a beautiful neck. We're going to buy her necklace today after this one. Okay. So now you see 2 prefrontal, prevertebral muscles. And then let's say this is a C5, C6 level. But how do we know? Now we can tell by looking for tubercle. So when I move, we already start to see anterior scalene, right? Where's the anterior scalene? That's the anterior scalene. Good. Why is that? There is a traffic light sign. Oh my God, Amy, you're the best. Look at that.
Oh yeah.
1
nice
C5,
problem.
the snowman. 2, that's the C6. We learned yesterday C6 usually has 2 elements. So I got very, underneath there's a round one coming below that one. See dark one? That's C7. C7 now. We know more than before, or clearly know, right? See, so now look at this. I'm moving this. This is the brachial plexus between anterior scalene and middle scalene. I'm going to move middle scalene. Yesterday we talked but I still didn't have the. So look at this. Oh, here. Can you freeze?
Where's the freeze?
Bottom right.
P1?
P1 is the save.
It looks like arrows facing each other.
I think I did it.
Yeah.
You did. Good. So what I'm going to do, cursor. Oh, when we
It's way
freeze,
better over there.
yeah, this one. This is the posterior. I can say this is the posterior tubercle. Why is that? There is a
There's
C7. There's no anterior tubercle, right? Almost C7 is posterior tubercle is high. That looks like chair, right? Looks like this is the bone shadow, right?
Oh, you
Looks like a chair. See,
Yeah,
sliding away. And this is the C7. We already studied, right? This is the C7, and then above C6, C5. So with anterior tubercle, posterior tubercle, we know in the C7 level.
Wait, what is this? One time. This thing?
Oh, that's the C7 nerve
C7
root.
Ah.
Round like sunset. It's going to sunset. We're gonna go back and forth. Okay, unfreeze.
So this two.
Oh,
Sorry.
sorry about
No,
that. It's too late, okay? So now, as I'm in the middle, and as I comes down, anterior scaling, you see? See, now I see tubercle very well. The in and out. Do you see it? Oh, good. Heidi is putting her probe, not the probe, arrow. So the white is the C7 posterior tubercle, and then dark in the front, round one is C7 root. No. In front of that, yeah. So now you guys very clear. This is the C7 nerve root. As I move my probe upstairs, you start to see over there C6 coming out. So let's move the see traffic light. I'm sure everybody is looking at it as I go up.
That's what I don't understand.
See here. See, that's the C6. Then we have to find the anterior tubercle is the higher. Do you see it? That one. You can freeze. So yeah. So if we move cursor, this is the anterior tubercle. This is the posterior tubercle. You see bone shadow, and this is the bone shadow too. This the round is the C6. How do I know? Anterior tubercle height is much higher. Posterior tubercle is lower. Look at this. I'm drawing now like this. You saw my lecture yesterday, and this is the C6. If you have a question, text me.
Dr. Healyung, why does C5 look like this number 2 now?
Oh no, but because we're going there, it could be C5, 6. Heidi is asking question why C5 looks like a snowman. What do I know? I don't know. It could be C5, C4 actually, but according to all the studies, 6 usually 2, mostly 2 elements. So as I said, there could be C5 and C4. C4 is almost the same anterior posterior height. So when you have questions, don't ask me. I don't know. Let's figure it out. Let's figure it out. Who knows? We can just slow. Here, once again, thyroid gland, tracheae, longus colli, longus capitis, right? And then you remember in the carotid sheath, we can see internal jugular vein. Let's say, can you show the SCM? SCM, right? And then underneath the round, very round, pumping one is the carotid artery. Next to I can collapse that one. That one is the internal jugular vein. And then underneath is the white one, round dot. That's the vagus nerve. That's the vagus nerve. You know what? If you ask me, I was talking about recurrent laryngeal nerve. I never look for it. But if I go, I think lower between the trachea and maybe that could be the cursor area. That could be the, you see the round dot, right? Do you see it? Like in and out, in and out? That could be recurrent laryngeal nerve. Okay? So we studied this one. So carotid sheath as an internal jugular vein, and then carotid artery and vagus nerve. And then if I move to more posterior, we call the posterior neck, right? Turn your head. SCM, in the posterior surface of the SCM, and then upper trapezius, we call the posterior triangle, right? Posterior triangle, I'm moving my probe to posterior triangle. Oh, there's a, look at this tall tubercle pops out, right? Yeah. That must be C6 because anterior is high, posterior is low. Do you see? Can you freeze? You can see very well. Actually,
Yeah.
the YouTube shows better even. No, the cursor, I'm sorry. Because I moved this one, so it looks ugly. But this is the anterior tubercle. This is the posterior tubercle. There's round C6 nerve root. And anterior scalene, middle scalene. Okay? Let's go one more time. So, oops. Once again, we came to this longus colli, and then I'm moving here, anterior scalene, and then now we see tubercle too much, right? And then relax, and
So
then
this is C6.
C6, right? Anterior tubercle is very high. As I go up, well, let's find out the traffic light. Now we are losing the traffic light, right? Only tubercle, we keep seeing tubercle. We lost a little bit. Oh my God, look at this. Keep coming. Maybe put a little bit. And then,
But there it is.
oh, there it is. So here, traffic light C6, C5, right? And then what did I say? Phrenic nerve. Phrenic nerve runs in front of the anterior scalene. So if you see phrenic, I see now. Can you? There's that. Can you freeze?
It's really weird to see over here.
I know that's really bad. This is the phrenic nerve. You see it here? This phrenic nerve in between SCM and the anterior scalene, which means we are in the about C6 level, right? You remember when I go the phrenic nerve from where? C3, 4, 5. So the 3, 4, if you go more close to proximal part, it is going out from the anterior scalene. So let's take a look. Here, right? So when I see here, look at the dark dot on the that one. When I move, oh, it's not really nice to show though. We usually.
It does move. I mean,
Oh, I only see the tubercle more. Well, we are experts in it. I see here this level. So usually, if I go up, let's follow this root. If I move root, see now it's C6 is sunken down, right? You see it? C6 is going. Yeah, good. Thank you. Going down, disappeared. Now C5 left over there. That's C5, right? C5 is going down now. Here, that one, yeah. 2 tubercle, you can see 2 tubercle. Maybe you guys watching through YouTube may not be easy, but can you? This is the round dot. It was C5, and we should see. Oh here.
Tubercle.
Oh, I see. Phrenic nerve. Can you freeze?
that.
This one. So this one.
Ah.
So that's almost anterior, in front of
This one?
anterior. Yeah. Oh, what? This one. But here it doesn't look like. Okay, let's open it again. See, do you see the movement, the little dot?
This here.
No, in front of that.
Oh.
Yeah, that 2 things.
This
Yeah, 1,
one?
2. Din, 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 din. It's
Oh.
moving, right?
Yeah.
So I know some people say, "Oh, I don't see it at all." But you practice, okay? We cannot practice. You practice by yourself. So another one. What did we have? Only 10 minutes left. So now you see traffic light again here. So where you're gonna find that traffic light? A little lower, because it has to be C5, 6 together. So you have to bring it down to a little distal. You see? Traffic light here. So C6 when we made sure, and then I bring it down. So this is the traffic light you can see well, right? Then this is the root and going into trunk. So if I move continuously, and as we discussed, supraclavicular area. So here, this is the sternum, and then upper trapezius here, about lateral 1/3, but your home base is subclavian artery. Once you find the subclavian artery, and then look at the lateral side to the subclavian artery, you will find out the lotus root shape, which it could be trunk or division, going into division level.
Okay.
So some, if you study, some books as trunk, some books as division. So I think it's like a branching out.
Both, yeah.
Yeah, both at that level. So I thought like we can finish it very quick today, but it's not. Okay. So medial side with the medial, left side with the medial side. So let's clavicle here, and I'm gonna find the first. There's already. Look at this. Where is my probe? Probe is long. So after the midline of the neck, about 1 finger breadth, your anterior part of the probe. And then you can see the dark one, pumping one. And then Heidi is going to put the color flow. See it here. Do you see it? That is the subclavian artery because it's pumping. And the medial to the subclavian artery is the subclavian vein. And then now I'm moving. I already see lotus. You can get rid of the... Heidi, do you see lotus root? Actually, that must be trunk. I see 3, C, 5, 6. Yeah, you see it, right? Actually, we can. We have a hard time to see. Look at the ultrasound over there is better. So if you look at it, 3 things. This must be trunk because you can see upper trunk,
Right.
and then middle, lower. Middle lower is here. If I move my probe, you can see underneath 2. So let's say, can you try to use a gain to show a little more? See? Freeze. So here, look at this. It's not good, but if you look at it, this area, this is the subclavian artery, right? And then lateral to subclavian artery, you see like a dot, looks like a lotus root. And this is 1, 2, 3 is upper trunk. And then these 2 things are middle trunk. And the lower trunk is 1, but I cannot see here. So this, you can see now even, right? Upper 1, 2, 3. 1, 2. In the lower, you cannot see well.
Right.
Okay? So let's go back and then study the... Now you can see even better, right? Because we learned. So, I can show the omohyoid muscle too. Because omohyoid muscle, inferior part is here, and then it goes to the anteriorly to the superiorly. I'm sorry, superiorly. This is the inferior part of the omohyoid. It goes like this. Hyoid is here, so up goes like this. So look at it. Where is the omohyoid muscle? This is the omohyoid muscle. Above the subclavian artery. This is the muscle. So can you guys see it? The cursor? Yeah, that's it. Muscle stripes. That's the omohyoid muscle. And then subclavian artery. And then, there's lotus better. Looks better here. Right? 3. It's very clear. That's the trunk level. And then, as I said, the division goes underneath of the clavicle. And therefore, it doesn't give the nerve at all. Okay? Here, you can see long pleura over there. This white line is the first rib. Okay? That's the first rib. And clavicle on the right upper a little bit. That's clavicle. And then, so everybody understood? Underneath is the pleura. Yeah, that's the pleura. Breathe in and out. So you can see it. First rib coming up and down. Very good, thank you. Then, last one, we have to go underneath of the clavicle. I wish model is a man today, but because I feel bad to go downstairs. Okay, is that okay, Amy?
Yeah.
All right. Where's all my male residents today?
Not here.
Oh, they're not here. They're lazy. Okay, so you remember there's a coracoid process here, right? And then coracoid process is the three muscles are inserting over there. One is the pectoralis
Biceps.
minor, biceps,
Brachial.
shorehead, coracobrachialis. So we're gonna go that direction. So you already see. I wish I can find out today. Can you make it deeper?
Oh, where's the depth? This one?
Yeah. Bring it down continuously. Let's say we see long, major. We have to find the axillary artery. Axillary artery must be here. Can you put the color flow? Underneath.
Yeah.
Looks
Okay,
like around
let's see.
here to
Oh.
me. Because it's gonna go to axillary later. Can you move your? I think you have to make it deeper. We are ladies, so move your box to the
And down.
down.
Yeah.
Yeah. Because this is the adipose tissues.
Yeah.
Can you do it?
More depth?
No. Can you use your cursor?
There we go.
Look at the cursor. On the top is the adipose or subcutaneous tissue. Underneath is the pectoralis major, and I clarify pectoralis minor. Oh, there's a. I see now. Minor. Yeah, that's the minor. You see axillary artery over there? Move your box to a little darker round. Yeah, that one. Move. Scroll with your.
This was not working. It's not moving.
Oh,
Get rid of the cursor?
Mm.
Yeah, there we go.
that area. Yeah. We found the axillary artery. Look at this. Where is my probe? It's very close to the axillar. And then now. Would disappear?
Yeah.
Oh, there. Move. Yeah. Good.
There we go.
So actually, you can see the. Can you freeze? Oh, okay.
Oh, wait.
Leave the color flow.
Yep, right there.
Freeze.
Okay, there we
Okay,
go.
good. Whew, sorry.
Yeah.
So cursor. So look at this. Subcutaneous tissue. Pectoralis major. Minor, you can see lateral pectoral nerve here actually. Lateral pectoral nerve. And then this is the axillary artery. It's actually larger, but we stopped. And then you can see this white stuff. This is actually cord. Cord is moving from, as you go down, this cord is it's going to be in the up, and it moves like this. So lateral cord stays in the lateral to the axillary artery. Posterior cord stays in the posterior to the axillary artery, and medial cord stay in the medial side. So between the lateral cord, medial cord, this is the posterior cord. Did you get it? Oh, that looks really good
That looks
actually.
good on-
Oh,
yeah.
really good. So this is the lateral cord. Still, it didn't move to the lateral side yet because as you move your probe down, actually the cord moves. So this is the lateral cord, posterior cord, and the medial cord. Okay, so we're gonna finish our lecture or workshop today. I appreciate that Heidi and Amy become the best model. But if you guys have questions, go back to my lecture, and then you can double check. And then we're gonna continue this workshop anyway. So please review my talk and any teaching material, and then master this face and neck. So see you next week.
Bye.
Bye.